Next couple of hours at about midnight tonight, Kenya receives its first shipment of the Oxford Astra zeneca vaccine. Well, Health CSD talk about over 1 million doses, and to help us shed more light on this is Health PS Susan Mochache. Karibu sana.
Thank you very much, Njue,
Madam PS, perhaps we can start with you can shed light more on the shipment that is arriving tonight.
Yeah. So today at about midnight, we are going to be receiving our first dose of a vaccine in the country. And we are very happy about that because a few weeks ago, it was not very clear when we will receive the vaccine, because as you know, there is such a huge demand out there. So the supply is quite disrupted. So we are very happy that we were lined up amongst the first countries within the continent, Africa, to receive the vaccine. So when the vaccine arrives today at midnight, we will then move it to our central warehouse, which is somewhere in Athi River. And once it is there, tomorrow we will be busy packing it, ready for dispatch to the various counties in the country.
And you have a deployment plan in place, of which you shared with the World Health Organization. Kindly, you can shed light on that as well.
Yeah, so 2 months or 3 months ago, we set up a team, a task force, whose work was just to think through how we were going to acquire and roll out the vaccine, the COVID vaccine in the country. So the team has worked very hard and working very closely with Gavi, which is the main partner who is supporting us in accessing the vaccines. And so we have a very clear projection of the vaccine requirement in the country and looking at the time frames within which we will have the vaccine reaching everybody who is intended to get the vaccine. So it is a very detailed and a very well-costed plan that we submitted to WHO, who needed to certify it before, the Gavi could even give it consideration. And we are happy that we also made it on that one. Our deployment plan was very satisfactory, and it's on the basis of that that we are receiving our initial doses of 1 million vaccines tonight.
And it's an open secret that a lot of Kenyans have expressed their reservations in terms of the efficacy and in terms of the safety of this vaccine. Can you dispel those fears?
I think the concerns and the fears around the vaccine are not just in Kenya. These are concerns by, everybody in the world, because typically vaccines take a longer time to be produced. But these ones have had to be done very, very quickly. But what I would like to assure our people is that by the time a vaccine is being approved by the very stringent regulators, the US regulator, which is the FDA, or UK regulator, or the EU, and WHO certifying it, it is definitely a vaccine that has met and given satisfactory proof that it is safe for people. Because if you look at the world right now, there are countries who are almost finishing with vaccination of their population. So really, we have to weigh the risk vis-a-vis the benefits. And the benefits of having a vaccine far outweigh the risks. And so far, based on what has the vaccination that have been done and the research that is still ongoing, this is a safe vaccine. Otherwise, it would not get the blessings of some of the top regulators in the world and WHO as well. So I want to assure all Kenyans that the vaccine is safe. The only thing, of course, is that not everybody gets vaccinated. There are people who are not eligible. So the vaccine just targets people who are 18 years and above. So anyone below 18 cannot take the vaccine. The other thing is that the vaccine will not be given to somebody who's pregnant. So that is also another consideration. So really, and then there are some special allergies, which, when you're going for the vaccine, the healthcare worker will ask, like, allergy to egg, that we have been told would be one of the reasons why perhaps somebody can't take. That's the only one that I'm aware of. So besides that, the vaccine is safe to use, and it will be there for anybody who can take it. But we have to be very clear to also say that at this time, this is the phase 1 of the vaccines. And we are going to be rolling it out based on the categorization that informs us in terms of who are the first people to be protected? So for now, it's the frontline workers, the health care workers, because we must ensure that there's continuity of health services, because if our health workers get exposed to COVID and, it takes a few of them, obviously the health system can actually crumble, and we have seen that happening in some parts of the world. So the first thing you want to do is to secure your frontline workers, make sure that they are all protected against COVID. Then you move to others, such as the ones that really, the instructors, the teachers in schools, the lecturers in universities. So we move to that. The security personnel, uniformed personnel, the police themselves because of the interaction with the public, the prison wardens, of course the military. So that is the whole category that is covered within phase 1. Then when we move to phase 2, we will now be looking at people who are vulnerable because of the comorbidities that they have. That is, somebody living with cancer, so their immunity is sort of compromised. People who have diabetes, people who have a problem with high blood pressure. So all those are in the category of high risk. So these are people, if they contracted COVID, their chances of survival become slimmer. So we will target that. We will also target elderly people over 50, because again, we have seen the history of COVID. It's very severe in people of older age. So we want to protect our most vulnerable. And so that vulnerable group will be the next area that we'll be concentrating on under phase 2. And then eventually, then the vaccine can be availed to anybody who just feels that they want to be covered.
And perhaps we can touch on the timelines, because even looking at Nairobi has been recording the largest numbers of COVID-19 cases. Are we going to be getting preferential treatment perhaps for Nairobi, because Nairobi is worst hit and some counties are registering 2, 3 per day? What are the timelines of these phases?
I think, one, let us accept that the vaccines are not available in the quantities that we would like. They are really determined by what is available in the global market, and that is why between now and May, Kenya has just been allocated 1 million doses. But come May, we are going to be receiving our next doses, which will now be getting us to 4.1 million. So for now, you can basically say that between now and April, May, you're looking at 500,000 Kenyans, because, this is a double dose. So once you vaccinate the first time, after 8 weeks, you have to vaccinate again. So the consignment we have will cover 500,000 people. And, the truth is also, in terms of the practicability, how you are injecting and the rate of injection is not something that can be done, that quickly. It will take us a few weeks. So come April, one other thing that is going to happen, we'll have clarity about our next consignment, because the total number of vaccines we expect in the country under this arrangement with Gavi is 36 million doses. So you're talking about doses that will cover 15 million people in the country. So come April, we will know when will be the next consignment, because by May we will have received 4.1 million. So, and for now, no one can actually tell you when to start estimating for the next consignment, because again, the disruptions in the global supply. But we are confident that the path that which we have started with COVID, with Gavi, the very quick response just demonstrates that we should not expect to have long periods of time without the vaccine. We will, and we also believe that as time moves on, we will access other types of vaccines. But for now, what Gavi has been able to secure for us and other developing countries is the AstraZeneca.
And talking of concerns, have the healthcare workers been informed, and perhaps if there's needs for training? Because yesterday, the Kenya National Union of Nurses Secretary General Seth Panyako did talk about they are still also in the dark.
Well, COVID, is not a normal phenomenon. And, I keep saying that if you look at how we were waiting for commodities when COVID just came, when you're waiting for the test kits and, even the PPEs in the early days, there were never guarantees about delivery until they got to your country. You would not put, your plans on that. So even for this, we only got confirmation just about a week ago from Gavi that they will be shipping 1 million initial doses. And so then we got confirmation that they will be coming today at midnight. So again, you have to wait to wait it out. So now that we are very, very sure, this is why we are now coming out to say that the vaccines are here. There is nothing that is mysterious about it. It is better for us not to have talked about a situation which we are not sure about. But now that they are here, we can confidently say, and now that we have been told they've been shipped, we can confidently say that the vaccines will be in the country tonight. So just to tell the health workers that, this is not a new conversation. We have been talking about availing vaccines. We as a ministry have been talking about health workers and other frontline workers being the target group. And it's just that, the vaccine is finally here. And beginning the end of this week, they will start getting vaccinated.
Indeed. And talking of the medicine, kindly take us through the distribution chain from when we take it to our safe houses. The distribution process. How is it?
Okay, so one, let's remember that we already have an existing infrastructure that supports immunization. Immunization is not new in the country. We immunize our children all the time. And so we are basically going to use that same infrastructure. So when the vaccines come, they will go to our central store. Then tomorrow they will be packed, ready for dispatch to the different regional centers, because we have got the regional depots for vaccines, and these are special facilities because they are built in a way that they maintain very low temperatures, because you have to store the vaccines in very low temperatures, and the trucks that will also be transporting them are refrigerated trucks. So when they get to the regional depots, they will then be distributed downward to the county facilities. And for this week, we are focusing on just reaching one facility per county, so that we also learn as we are walking along. And so from next week is when we see ourselves beginning to now, go down to all the facilities within the different sub-counties. And, we are looking at having the vaccine available in level 3 up to level 3 hospitals. So we'll start with the level 4s, the level 5, the national referral hospitals, then down to those. In addition, the private sector, the private hospitals will also be given doses of the vaccine, and so will the faith-based churches. Because again, with the private sector and faith-based, we have already existing collaboration in terms of vaccination, say for the children, because those vaccines are provided free by the government. And so usually we work with them. So even for COVID, we are going to be giving them the vaccines, and they should be able to administer, and at no cost at all. Particularly now that we are dealing with an issue and an emergency circumstance, nobody is expected to charge for this vaccine. And indeed, if we find anybody charging, we may discontinue giving them the vaccines, because these vaccines are also coming as a grant from Gavi, and the government will also be putting in some money into it. And so really, we cannot trade with them. They'll have to be administered to Kenyans free of charge. However, when we now move to the commercial side, where the private sector can now bring in their own vaccines, then at that point, perhaps, they will be able to charge. And of course, we'll also try to ensure that it's not exorbitant, but they are reasonable charges for any Kenyan who can afford and does not want to really wait for, the way that we have scheduled the rollout.
And last year, your ministry did form a national task force on the distribution of COVID vaccine. Kindly touch on the progress of the task force. Yeah,
actually, that is the task force on the deployment, first the procurement and deployment of the COVID-19 vaccine. We are very happy with the way that they have worked. They've been doing a lot of activities in terms of, planning about this exercise that will now be beginning from tomorrow and tonight when we receive the vaccine. And in addition to that, they've also laid out a very elaborate plan on capacity building. And as we speak right now, we have health workers from the 47 counties here in Nairobi for training, the ones who will be doing the vaccination, and the ones who will also be going down to train. at the county levels. We also have county officers who have got an ICT background, and we are also training them because we are going to write this whole vaccination plan based on an ICT system. So we will be using technology to manage, you know, the data storage, and also to just remind people when they are due for their second doses. It will all be on that ICT platform. So all these individuals are now in Nairobi. They are going through training, and they will also continue to have another batch tomorrow. We will be training them, and this is going to be a continuous exercise as we move along. But the team has done a very commendable job. Not to also, you know, mention that besides the work that they have done on getting us to this point, they've also done the budgets and, you know, the whole financial plan around the vaccine. So the team is doing well, and it will continue to work because they've also, by the way, developed the ICT portal, the www.chanjo@health.go.ke, the platform with which people will be registering. So we are very proud of what they have done, and we are confident that, you know, with them in place, and, you know, we'll continue to move this agenda very well. To also mention, finally, I think one of the most important activities we have undertaken as part of that task force is to engage with various stakeholders. So we've engaged with the, you know, the interfaith committees. We have engaged with private sector. We've tried to cover as many stakeholders as possible in discussions around this COVID-19 vaccine. And so far, all stakeholders have been very, very receptive to this.
Indeed. And we are shipping in Oxford AstraZeneca. There are plans perhaps to incorporate other companies that are manufacturing or making the vaccines. And of course, there is a ray of hope because 170 companies are in their final trials of the vaccine, or we are going to stick with the Oxford AstraZeneca?
Okay, for now, under this COVAX facility by Gavi, we've been allocated the AstraZeneca. But as time moves along, and when they give us now the second set of doses, they may now be looking at other brands. But as of now, what I know is that it's unlikely for us to get, say, Pfizer or Moderna or Johnson before the end of the year, because, you know, those manufacturers are already locked with orders from some of the bigger and stronger economic countries. But at some point, definitely, we are going to see the other vaccines coming in, but it may not be as soon as we expect, really, yeah. So for now, we see AstraZeneca being the primary one for the next 3 or 4 months.
As we wind up, of course, we've witnessed a surge in the recent past of COVID-19 cases, and especially in Nairobi and other big towns. How are you addressing that as we have now we are waiting for the vaccine, the surging numbers, and also as we wind up also, how are you going to address all the loopholes or any loophole that may bring about a graft in the process of distribution?
Okay, perhaps the easier one to start with is the issue of graft, and to say that, you know, what happened with some of the procurements around the COVID commodities at KEMSA was really unfortunate. I think there were people who thought that the country needed so much PPEs and went and bought a lot of them, and in maybe a process that is being challenged. And, you know, learning from that experience, we are putting better safeguards. There's a much stronger oversight on anything to do with the procurement of health products. So we are not only dealing with COVID. Anything that we are asking to be procured, we have put a very strong oversight over it. We have now, as a ministry, finally developed a system that allows us to also just track what's going on in KEMSA, and we are able to quickly get any, you know, flaggings of anything that may be a bit irregular. Also remember, after His Excellency the President directed that the processes in KEMSA must be open and transparent, we immediately moved all the activities and financial management to IFMIS, and IFMIS is a good system. So we are now having the kind of openness that you would not have had before. If you go to the KEMSA website, you will know which tenders have been put out. You will know the different stages at which those different tenders are at. So we are working very hard to ensure that that accountability framework is in place. And we are not working alone. Our development partners have also been very key, and they have also really given us very good technical support to strengthen the systems at KEMSA, because we procure literally all our health commodities through KEMSA. But I must say that for purposes of this vaccine, the procurement is being handled by UNICEF, and that is a choice that Gavi has made, not just to Kenya, but for all countries where they are supporting the provision of vaccine. So we are not even dealing with procurement of these commodities as we speak. It is purely a UNICEF process. I think
on the surge or the cases?
The issue of the surge, in fact, a good question. Of course, we are very concerned about the state of affairs and the fact that we are seeing an increase in the number of cases of COVID, and the positivity rate as well is seeming to be on an incremental path. And certainly, it doesn't leave anybody feeling comfortable. So what we are just urging and really calling out, that in as much as, life has to go on and we must continue to engage on the various things that we must do, the important thing is to ensure that we do not tighten our belts in as far as adhering to the protocols. We must endeavor to ensure that we keep our social distances, that we wear our masks even when we are going for some of these meetings, and really to just take personal responsibility. We challenge the politicians to take responsibility, and also the citizens. Don't take yourself into a crowd and you have no mask. So really, at the end of the day, we have got to collectively take responsibility and begin to push the curve downward. Because again, if we do not do that, we risk then, having more restrictions imposed, because we must contain the spread of the disease. And I don't think it's necessary if we all just agreed that we must do what we must do.
Indeed. Thank you so much, Madam Pierce. Unfortunately, we are out of time, but I'm quite sure you lead by example by taking the first jab. We
Indeed.
saw Joe Biden do the same thing.
On Thursday, I'll be among the very first people to take the vaccine, and I look forward.
Yes, thank you so much for making time. We have been speaking to Health PS Madam Susan Mochache, shedding more light on the COVID-19 vaccine, the Oxford AstraZeneca, which is expected in the country a few hours from now. Thank you indeed so much for watching.